Today, I want to share a case that really highlights how important supportive care can be when someone is using GLP-1 medications and what their experience can be like on that medication, especially with an interesting background and history. I will note that this case is really important to me because it is the first research I published as a lead author. So it has to do with GLP-1 migraines and mitochondria. So this client was a 40-year-old woman who came to me shortly after starting Ozempic. And her background history is really interesting because she had inflammatory bowel disease, Hashimoto's disease, infertility requiring multiple rounds of IVF. And when she came to me, she had had her second child. So she was struggling with postpartum weight retention, hot flashes, night sweats, and then nausea from the medication that was getting significantly worse. So, because she was focusing on weight loss, I looked at her gut health, her hormones, her inflammation, and her mitochondrial function and how that could be interacting with the medication. So, I took a different approach with her. And we introduced some supportive strategies like ginger for nausea. We structured her eating and protein timing to stabilize her blood sugar. And then her migraines were persistent. And so, this is when I started noticing maybe we need to add targeted micronutrients to really support that mitochondrial health and her nervous system reliance. So she changed from Ozempic to tirzepatide. So if you're not familiar, she went from just GLP-1 to GLP-1 plus GIP, which is a different peptide hormone as well. So she then continued with the nutrition, lifestyle, supplement support I was doing with her, and her migraines began to improve a little. But what we really need to do is we needed to target her mitochondria. So what we did is we introduced some antioxidants, we introduced vitamins that are especially important for mitochondrial function. And what we saw was energy stability. We saw that her fatigue was gone. We saw that she was doing a whole lot better with migraines. She wasn't having them come on regularly. She felt like she could eat something and it wouldn't trigger one in the next day or so. So again, I mentioned this case was published as a clinical report because it really highlights how important integrative nutrition and mitochondrial support are, especially when someone is on a GLP-1 therapy, because sometimes a client can be told, oh, GLP-1s just aren't for you. You're not going to respond well. Oh, you had migraines in the past. Maybe this isn't good for you, but maybe they just need a little tweak. Maybe they just need a little bit of help so that they can take these medications and they can be supported along the way and those symptoms can be held at bay.